Anybody? The Ramones? Does anybody even listen to the Ramones anymore?
No, but
nobody listens to the Ramones anymore. Is that shallow? Is that superficial? Is it?
This is the end of season 5.
And so when this week happened, we were able to really pinpoint who we wanted to answer what story.
This is our closer for season 5. And this is really the closer for sort of this iteration while we sort of shut down and work on launching the next thing.
Half the people who die of suicide didn't have significant mental health histories.
We're here kind of to break down some of what happened this week, especially related to the SPSM community, because a lot of SPSMers were in the media talking about suicide.
I'm glad that we've broken up the conversation and we're starting to look at cultural dynamics. We're starting to say that this just is a mental health issue.
So glad, Marketplace, that you want to talk about money. Let's talk about money.
And we also need to be much more focused on folks that aren't in mental health care, that aren't getting services, and don't meet criteria for mental illness.
The time to learn how to be a firefighter is not when somebody sees smoke. The time is you train and then you respond.
So what you see is when we cover these issues, when this information is out there, we saw it with Robin Williams, call volume goes up and it goes up dramatically.
How do you build a life worth living under what has been really hard economic times, especially if you're a white male with less education?
The crisis line workers are really the unsung heroes. While everybody else is out tweeting these numbers or Facebooking the numbers call, there's really human beings who are answering these flood of calls that are coming in.
Most Americans don't have breast cancer. Most Americans don't have HIV. Most Americans don't have a lot of things, and we'll put a fuck ton of resources into it. Most Americans don't have fucking smallpox. You want to know how many Americans have smallpox? I'll tell you, P.F. Anderson, how many Americans have smallpox? 0, and we spend the exact same amount on preventing smallpox as we do suicide. So you can tell them that.
We are constantly pushing out the Suicide Lifeline phone number, but the federal government, for the most part, is not funding the crisis system.
Why do people die by suicide? And I was like, well, we don't know. Well, yeah, we do, and there are signs. No, not really. We don't know, and the research isn't very good. And then they were like, what do you mean? The research isn't very good. By the way, because we spend your money on smallpox and other things. We didn't spend it on suicide.
How much research gets churned out about suicide every year? A lot. How much of that research is applied in a meaningful way? Almost fucking none.
We have the science of suicide that we paid for. We have the system of intervention that we paid for, which is to say, not much.
The bigger issue is that we've got a field that has been unethical, irresponsible, and should be held accountable for not making sure that the professionals that are operating in healthcare are adequately trained in evidence-based practices to both detect and intervene with people at risk of suicide.
Given that Joe Franklin's paper says that your ability to predict risk is less than chance, good luck. Let me know what you fixed the problem.
They expect us to save the world every day, but with no fucking money.
It's not just a template. It's not just, this is the same information that we put out every single time. This is the particular angle, this is the particular messaging point that we want to focus on here because it's effective in communicating what we're trying to get across to the public.
Different people have different messages that were specific to their audiences, specific to that media outlet, specific to their expertise.
All of the work that we've done to make it easier to talk about suicide is paying off.
We need to be able to respond just as quickly as we have now, and we are doing, but we need to make sure that we don't get complacent. We don't rest on our laurels.
The truth is, cultural change, system change can happen really quickly. What problems do today seem impossible that you think if we solved them would make a difference?